Great. Well, good evening, everyone. My name is Shannon Burke. I'm the Director of Regional Programs at Lakeridge Health. Very excited to have everyone with us here today. I'll start by introducing Stephanie Hutton. Stephanie's going to take us through some of the benefits of eConsult for specialty providers. And Stephanie is the Regional eConsult Coordinator at CMO, the Southeastern Ontario Academic Medical Organization. So Stephanie has brought with her some esteemed guests and colleagues to help us on a panel discussion in the end. But really, we're focused on learning a little bit more about eConsult and what the great benefits it provides. I'm very excited to hear this information. So thanks for coming, Stephanie. We are recording the session so that we can send it out for any of your colleagues that missed the information or the opportunity to join. And we also have this as an accredited talk through CME credits. So we will be able to issue you a certificate for participation. So if your little bubble beside your name in Teams doesn't come up with your full name, please just put it in the chat so that when Caitlin is putting together certificates for attendees, she can credit your name appropriately. Sometimes it comes up with like your email address or something that might not be your full name. So whatever name you want to show up on that certificate, make sure we know it. And without further ado, I'll turn over to Stephanie to take us through tonight's talk.
Awesome. Thank you, Shannon. So thank you, everybody, for attending and joining in this evening, or if you're joining us asynchronously afterwards, thank you for taking the time to learn a little bit more about eConsult with us this evening. So just to get started, I wanted to introduce myself. So my name is Stephanie Hutton. I'm the Regional eConsult Service Coordinator working with CMO. So that is the Southeastern Ontario Academic Medical Organization. And we serve as the deployment team for the eConsult service, not only within the Southeast region, but we've also now expanded our reach to the Central East region, which is the reason we are speaking with you all this evening. So myself, along with Danielle Claus, who is the Executive Director of CMO, we comprise the digital health team, and all of the work we do, we support primary care providers and specialists in their use of the eConsult service. So this work includes, but isn't limited to, the education and promotion of eConsult, the onboarding and recruitment of providers, any technical support, and then also making sure that we have the ability to have regional eConsult groups, so creating and managing those groups to make sure that specialties and subspecialties are available for providers in our regions. So to get started, as there may be people on the call with varying levels of familiarity for eConsult, what is the eConsult service? So eConsult is a secure asynchronous online tool/service, and this is a program that allows for providers to send patient-specific clinical questions to specialists and receive advice for treatment within 7 days or less. eConsult often eliminates the need for a face-to-face visit with a specialist, so it really helps us with the reduction of those referral wait times and increasing that access to care. So really helping to build that community of practice between the requesting provider and the eConsult responding specialists. The service is hosted on the OTN Hub platform, so it is entirely web-based with some possible integrations, which we'll talk about a little bit later this evening. And the service is available at no additional cost to our providers. So it is available to all primary care and specialist providers across Ontario to use as eConsult senders or a specialist to be eConsult responders. So let's talk about some of the benefits of the eConsult program. So first and foremost, it's really working to improve the patient experience and access to care. So across the province and within multiple regions across Ontario, we have a number of specialties and subspecialties that are available, which allows providers to send those clinical questions, perhaps to specialties you might not have access to within your region, or you do not have an established connection with that specialist in your region, and you have that ability now to access that as a point of care. eConsults, as I mentioned, help with timely communication between providers. So because of its asynchronous nature, it is essentially the ability for you to connect with a provider at any point in time during your visit with a patient or any point in time when you are managing your administrative details for your care. And it also allows for our specialists to respond at any point in time during their service hours. eConsult works to reduce wait times. It helps to reduce those unnecessary referrals and appointments and our healthcare system costs. So as I mentioned earlier, the ability to send an eConsult can answer your clinical questions. Something you may have thought originally would be necessary for a referral appointment could possibly be managed at a primary care level. You're making sure that the people who actually need to be seen in person through that referral appointment are moving up a little bit further in that queue. And lastly, there are some incentives for participation in the eConsult program. So there are payment for services and formal documentation. So if you are a requesting primary care provider, where applicable, you have the ability to bill OHIP using the K738 fee code. And for our specialists, there are remuneration for your participation, which we'll discuss a little bit later, as the majority of the providers on this call are specialists. But really where eConsult shines is that it enables primary care providers to gain the expertise of specialists and their advice prior to or in place of a patient referral appointment. It allows for primary care providers to prepare patients for their specialist appointments. So if they're going to still need to come in for that referral and they're going to have to experience that wait period in the queue, we can make the most of that wait time. So if there is additional tests or imaging that the specialist would like ordered before proceeding to a referral appointment, perhaps that those outcomes might be necessary to establish the point of care moving forward, we can make do with that wait time there. It also supports continued communication, improved care coordination, and professional relationships between primary care and specialists. So we're really building that community of practice, allowing for that open door communication between primary care and specialists, the ability to learn from one another. So that way, from the experience of this particular eConsult, you're able to learn and apply those learnings or that knowledge to patients in the future. So there is quite a bit of information on this next slide, and I will make sure that all of these slides are accessible to everybody following the call this evening. But I just wanted to take a moment to talk a little bit about some of the privacy, consent, and documentation information as it applies to requesting providers. So specialists are in a unique position on the eConsult service where they have the ability to send and respond to eConsults. So I want to make sure that this information is available to you as well. So the requesting provider is going to maintain their role as the health information custodian of personal health information that is created or collected through the process of the eConsult, and just being mindful that we need to follow all the existing rules, regulations, and laws as it comes forth with those matters. When it comes to the eConsult, patient consent is implied. However, we do recommend and advise as our providers get started with the eConsult service that best practice is to inform the patient of the tool that's being used, include them in the conversation, especially since we do have the ability to get those responses in such a timely manner. Patients may be even more willing to have their questions answered via eConsult and just want to make sure that it's everything that they are talking about is remaining in that circle of care and that they are advised of just exactly what is going on to obtain that specialist advice. Just making note that requesting providers should document the patient's medical record and any information that would normally be expected with any consult or referral request. So however you're choosing to manage your patient documentations, whether it's through an HIS system, if you're hospital-based, and EMR-based, if that's in your clinic, just being mindful that those documentations should be included for anything that transpires from the eConsult. But on the OTN Hub platform, we do have the ability to help manage that. So there are PDFs that can be exported, and you're able to search a case on the OTN Hub platform that you participated in at any point in time. So you're able to manage that there as well. And then lastly, as I mentioned before, where applicable, there are OHIP billing codes. So just being mindful to follow the schedule of benefits if that is something that would be applicable to your practice. And I can make sure that more information is provided following the session this evening. So what we would like to know is, how does an eConsult work? So submitting an eConsult can be done in a number of ways, and the eConsult case is often completed by the provider themselves, or we have the option for what's called a delegate to act on their behalf. So this is quite often an administrative professional or a referral clerk who is supporting the provider when it comes to all things consultations and referrals, and they're able to do so on the OTN Hub platform, or if applicable and available to your particular EMR, there are some integrations available, which we can go over a little bit later. So when it comes to sending an e-consult, there's one of two doors that I really like to visualize for people to understand how e-consults can be sent. So the first door is what we call the base managed specialty group. So here through this doorway, e-consults are sent to a group of specialists within a specific specialty or subspecialty, and from the requesting provider's region or from across the province. So this is a little bit more of a generalized e-consult. So again, being able to have that regional approach or provincially if it's not available within your region. And the second door that you have the option to go through is what we call the direct to specialist or group. So the group part can be a little confusing and sound very similar to the first option, but what really makes this avenue stand out is that e-consults are sent to a specific individual specialist or an organizational group, such as a particular clinic or program might be associated with the community or within the hospital, for example. And these are done by searching for that particular specialist by name or from that program by name. So this is a little bit more of an individualized, specific pathway for an e-consult. So once the e-consult has been sent, the e-consult is assigned to the provider and the response is provided by that specialist within 7 days or less. So all of our specialists are responding to their e-consults on the OTN Hub, and they're able to send any and all information that is pertaining to the e-consult back to the primary care provider using the OTN Hub platform. Depending on your EMR or any possible integrations, the most often route to retrieve your e-consult response is the OTN Hub platform. And the response can be viewed by the provider or the delegate if that's applicable. It's reviewed and then actioned. But the e-consult workflow does not stop there. Sometimes there is the need to submit additional information, possibly clarifying questions need to be asked or any sort of follow-up. So there is the opportunity for a back and forth communication between providers when it pertains to the e-consult case. The requesting provider is the person who has the agency to close the e-consult case when they feel that all their needs have been met. So if the advice you receive from a specialist is unclear, or you'd like some clarification, or on the flip side of that, perhaps the primary care provider did not provide enough information for you to give the accurate response or advice to move forward, you can ask those follow-up questions to ensure that the advice that you're giving is going to be the best option for that patient. And once the requesting provider, is satisfied with the response, has had all the needs met via their e-consult, they're able to complete the case and they're able to provide feedback to specialists as well. So this is where they have the opportunity to, if a particular specialist went above and beyond for them, to make that known. If they enjoyed resources that were probably or most likely shared, which a lot of our specialists do, they're able to make note of that. Or if they thought that something was missing from their e-consult response, they have the ability to provide that feedback as well. So just as much as our primary care providers are learning from specialists in the e-consult program, our specialists are learning what primary care needs and wants from their responses. So on this page here, you'll see that I have a chart just kind of outlining some of the e-consult integrations that are available at this time. As you can see, there are a number of different options depending on the EMR that is applicable to your practice. For most of our specialists, this probably is not applicable if you're not using an EMR and if you're operating off of a hospital information system, but still nice to know that this is what is available for the primary care providers who are sending e-consults to you, or if you're using one of these particular EMRs in your practice as well. You can see, regardless of the EMR that you're using, the support for delegates, whether on the OTN Hub platform, so anything web-based, is available regardless. So you always have that option to have that administrative support if that's in your office and you would like to do so. I will make note that the Ocean integration is currently in its phase 1. So if that is something that you are currently sending e-consults with, It is just a one-way direction. You're only able to send e-consults using the Ocean platform at this time. We are still working to build the future of the Ocean platform and how that relates to e-consults in terms of it being a full circle. So we are looking forward to the day that that is available, but at this time it is just for sending e-consults to get started. And if there is any additional information for the EMRs, I will also make sure that that is available following the session this afternoon. This is an interactive slide that you'll be able to click on your EMR and it takes you to the links for the particular EMR, or if you're fully integrated with OMD and that's an option, the information is available there for you. So as we were talking about the different ways to send e-consults, as it was mentioned for all of the specialties that we have available, I just wanted to make note to everybody that regardless of where you are in the province, you have access to this entire list of specialties and subspecialties that you can see on the screen here. And this list is always growing to make more available to you. So you can see here that, for example, if you were looking into gynecology, you have the ability to further subspecialize. You can go into pelvic mass imaging, urogynecology, or if you don't need that particular subspecialty, there's always the general option. So this, like I said, this list is ever growing, and the work that Danielle and I are doing at this time is we're making strides to make some of these specialties and subspecialties available at a regional level for our Central East providers. So not only will you have access to the provincial avenue, but you'll be able to start making connections with regional specialists close to you. Perhaps these are the specialists that you would be sending referrals to really start to build that connection with one another. So in terms of what is currently available in the Central East, so at this time, there are currently 55 specialists across 21 different specialties who are participating in the eConsult program and accepting cases via that direct to specialist model that I spoke about earlier. So they're able to be sent directly to this provider, and I will make sure that that full list is available to anybody on the call this evening. And for all those who aren't able to join as well. So as you can see, there are a number of specialties. And like I said, we are really working to make these as regional groups. So to make sure that a number of specialists for each of these specialties and continuing to grow that list is available for you as well. So noting that most of the people on this call or who will be watching this later are specialist physicians, we wanted to particularly speak about the benefits to your eConsult participation should you choose to do so. So very similar to primary care, we're looking at the ability to improve the patient experience and access to your specialty and your service, the ability to reduce wait times and those unnecessary referrals, the ability to enhance communication and build that relationship with the primary care providers and perhaps other specialists who might be referring to you, and really helping primary care providers better prepare patients for their appointments with you if that's necessary, helps ensure that all that necessary imaging and lab work is completed prior to that initial visit to really make sure you're making the most of that first encounter with a patient. But what we've also been learning from a lot of primary care providers and specialists is that they're also using eConsult as a way to include care directives and treatments that can be implemented while waiting for that referral appointment. So if there's ways to manage a particular condition during that wait period, ways that we can really make sure that the patient is cared for and their needs are met during that wait time, this is an excellent opportunity to do so. There are some expectations for enrollment if you choose to be an eConsult specialist and respond to eConsults. We are looking for experienced practitioners who are in good standing with the regulatory body. And we're also looking for people who are able to meet that 7-day service window. So even though the median response time with in the OH East region is currently at 2 days, which is fantastic, leads to a very quick turnaround, you do have the full 7 days to respond to an eConsult. A number of specialists choose to use this full time to consult with colleagues, do further research if that's required for the eConsult. So just because the median response is that shorter time period doesn't mean that that is what needs to occur for each eConsult. The content of a case is going to vary from provider to provider based on the patient's individual needs. So sometimes that longer response window really comes in handy to make sure that you're providing the best advice possible for primary care and that patient. We're also looking for specialists who really have that desire to interact with primary care. So our nurse practitioners, physicians, and soon to be midwives, to really help increase their capacity and knowledge, to help learn about this specialty, to ensure that they can provide this information and make it applicable to other cases in their practice moving forward. So like I mentioned earlier, really having that back and forth knowledge exchange and learning opportunity between provider groups. And as always, as I mentioned, there is that compensation aspect. So the time spent on an e-consult, so you are remunerated for your participation if you are responding to e-consults. This is a self-reported billing system. So the rate is $2.20 an hour, and that's rated in 5-minute increments, with some more details just available there on the screen for you. Typically, the e-consult response length right now on average is about 15 minutes. But as I mentioned earlier, that really all depends on the context of the e-consult case, the complexity of it, and the details that may be included from the requesting provider. But I think it's really important to note that there's also no set number of e-consults that each participant must complete in order to be a part of the service. So noting that physicians have a lot on their docket and other workload commitments, perhaps a certain period of time is not feasible for you to be able to be answering e-consults. So there is no minimum requirement. So that's why we have this self-reported billing at the end of that. And that makes sure that it's as accurate to the amount of time that you spend answering an e-consult as possible. So I just want to talk a little bit now about some survey results. So really you can see the impact that the e-consult program has had on primary care and the ability to move forward with care for patients. So first we'll look at the impact of the e-consult program on the need for that face-to-face referral that I've been talking about throughout the evening. So as you can see here, 48%, so almost half of the providers who are responding to this survey, who up until recently was every provider who completed an e-consult, these providers were saying that a referral was originally contemplated, but because of their ability to use the e-consult service and interact with specialists in this fashion, they were able to avoid that referral. So they're able to manage care at a primary care level. They were able to take an additional course of action. Maybe it's something they hadn't considered before. And there's also the subset of providers where they were originally contemplating a referral and found that that was still needed. So that was about 20% of providers. And through conversations with primary care, we find that even if a referral is still needed after your interactions on e-consult, it's nice to know that your original course of action was the correct path to be taking. So to have that affirmation that you were on the right track, primary care really appreciates that ability as well. And you can see that there were some other interactions in terms of the impact of e-consult as well. And then next we'll look at the impact of the e-consult program on how primary care chose to move forward with their course of action. So 59% said that they received good advice for a new or additional course of action. So really demonstrating that point that I was making earlier about the ability to learn from one another. So here providers got advice for something new that they may not have originally thought, a different course of treatment. Perhaps they learned of a different pathway that can be taken for that patient depending on the specialty. So really impacting how they provided care for that patient and how they might do so for patients moving forward. And then again, a large percent, so 38% of our providers said that their original course of action had been confirmed. So again, just reaffirming that they are on the right track. All right, so after receiving all this information, you might be intrigued and looking to get signed up for the service or participate as an e-consult sender or responder. So who can participate? So at this point in time, we have nurse practitioners and physicians who are able to start using the program as of today. And you also have the ability for delegates, as I've mentioned. So those are the professionals, referral clerks, nurses, administrators that can help you with managing e-consults on your behalf. And what is needed in order to get started? It's very simple. We only require 2 pieces of information from you. A OneID, so this acts as your digital identification credential to help authenticate and log you into the OTN Hub platform, and then an OTN Hub platform account, so that uses that OneID. Everything is web-based, as I mentioned, so even if you do have EMR integrations, you will always be able to use the OTN Hub web access as well. And then just on the screen here, I have a little bit of a pathway visual. So for anybody who would like to get started and you're thinking about how do I do so, there are a couple of different options. There is a self-service route if that is something that you are looking to do. Our physicians are able to get their OneIDs and OTN Hub accounts independently. Or if you are looking for a little bit of assistance, want to learn more, receive some more training, you do have the option for a virtual onboarding with myself, and I can walk you through all of the different steps and provide you with additional information when it relates to the OTN Hub platform and all things eConsult. So again, I will make sure that this pathway chart is available for you all following the call. It is interactive, so all of the links will bring you to everywhere that you need to go, and as well as our contact information should you have any questions or would like to schedule a session to get started. Okay, so you've heard a lot of talking from me, but at this point in time, I would like to introduce some of our panelists. So on the call this evening, we have 2 of our specialists from the Southeast region who have been responding to eConsults actively, and they're here to share a little bit about their experience and answer any questions that we may have. So I'd like to introduce Dr. Robin Holden and Dr. Jennifer Leung. Without further ado, I guess I will start with Dr. Holden. So Dr. Holden, if you'd like to introduce yourself and give us a quick summary of your experience with eConsult before we dive into some of our panel questions.
Sure. I'm Robin Holden. I've been an endocrinologist here in Kingston for something terrible like 33 years. And I got interested in doing eConsults for this reason. And it's just there aren't a lot of endocrinologists in the province, and they're certainly not evenly distributed across the province either. And I thought it wasn't really fair that people living in certain communities didn't have access to endocrinologists. And I thought this was a great way of being able to provide endocrine advice to primary care providers working in areas that don't have endocrinologists, huge parts of the province. And that's been my major motivation for getting started in the program. But I certainly love taking part in it. I find that it really helps to keep me sharp and up to date. And the questions I get asked are often ones that I haven't thought about myself. And I actually really enjoy researching and trying to figure out answers for some of these cases. I also love the fact that you can reduce wait times. Some patients don't need to be seen. You can get patients more ready for appointments. And then I use my involvement in the program all the time to think about continuing professional development. So if I get asked to speak at a program, I really know what primary care physicians want to hear on topics. So yeah, CPD planning has been huge. It's also helped us develop some local care pathways. We were getting asked some questions over and over again. So the endocrinologists all got together and we created a care pathway for workup of thyroid nodules. And we knew that this is something that people really needed. And now when people send me eConsult requests about thyroid nodules, I'm able to add our care pathway on. And then finally, if you've got any learners working with you, I use this eConsult as a teaching tool all the time. And sometimes at the end of a clinic, I'll bring up and I'll say, hey, I had some really interesting cases this week. And I'll throw up the question, and then I'll ask my learners, my residents, my medical students, how would you have responded? What would you have done? And it resonates well with learners as well. So those are my big joys in taking part in the program.
That's amazing. Thank you, Dr. Holden. And we'll discuss some of those topics that you brought up in a little bit more detail as we move forward with our panel, but I'll pass it over to Dr. Jennifer Leung to introduce yourself and provide us with some of your experiences with eConsult.
I'm Dr. Jennifer Leung. I'm one of the hematologists here in Kingston, Ontario. I've been doing eConsults for, I think, just under a year now. hematology was an area of particular demand, kind of where we're practicing locally here. Our wait list has been extremely long. And so what I find the e-consults are helpful for is really reducing the amount of referrals that we get for things like really mild normocytic anemia or things like really mild like lymphopenia or leukocytosis that are common problems where, you know, us as hematologists, we're not really going to add much by seeing the patient in person. But it does provide the patient with some reassurance that somebody has reviewed their results. And I think it provides the primary care provider also with some guidelines of what to do next and when to reach out for help. Yeah, certainly you do get some interesting questions sometimes, and you definitely identify those people who maybe do need to come to clinic right away. So yeah, it's definitely, it's interesting.
Wonderful, thank you. So I'm going to open up the panel portion of our segment this evening, and I'd like to ask you both, what has your experience been like as someone who's providing an e-consult response? So when I mention that, I'd like to know, like, what are some of the common questions or topics that you're receiving via e-consult that you find are well managed using this platform? And then on the opposite side of that, what topics don't lend themselves so well to e-consult and really should follow that traditional referral pathway?
So maybe I'll start.
Sure.
And as you mentioned, thyroid nodules, it's very common to find thyroid nodules. They don't all need to be seen. The workup can be in primary care, but who needs a biopsy? How long do you follow them for? It works really well through eConsult. I get tons of questions about male hypogonadism and which men should be started on testosterone replacement. And I should tell you, as a provider, some questions get so common that you can actually save your common responses, and you're often pasting in the monitoring you need to do on testosterone therapy just because you've been asked to do it so often. So sometimes it doesn't take you that long to do them. After a while, you've got your standard responses, and you can actually, if you can't remember your standard response, you can do a search function in eConsult, and you can look for some of the similar cases. You could find how you responded to this question last time, and you can cut and paste it in. Lots of osteoporosis, very common. People wanting to know about drug holidays nowadays. They haven't had a chance to read the latest guidelines. I have to read them. It's part of my specialty, so I'll bring you up to snuff on that. When to switch agents, when to start them, how to interpret bone density tests. A lot of questions about cholesterol, how to manage cholesterol, what the targets are, statin intolerance, thyroid tests. How do I interpret weird ones? So happy to do that. Which patients do need to be seen? How can you get them ready for appointments? Tons of questions about obesity nowadays, and particularly the use of the GLP-1 receptor agonists. So that's a lovely one, quick one to respond to and build up people's confidence. Some questions about anabolic steroids, and then transgender doesn't always need to be seen. We can get you started on advice about managing transgender. So those ones are really well suited for endocrine e-consults, but I'll stop talking for a bit and turn it over to Jennifer.
Sure. So I'd say the things we are commonly getting is mild normocytic anemia. So patients who have hemoglobins in the range of the 110s, 120s, who benefit from a bit of a standardized workup, but generally can just be monitored. Patients with abnormal serum protein electrophoresis results, for which we do actually have an MGUS pathway that we're able to refer patients to. Mild lymphopenia or lymphocytosis or neutrophilia, you can often identify just based on the history that the provider has given you that, these are patients who are chronically inflamed or who are smokers. What else? And then there is a thrombosis service that I think operates kind of separately from the general hematology, but I'm sure that they are super busy all the time too. Mild thrombocytopenia would be another one. Again, these people who have very mild findings that don't really benefit from coming to see a hematologist, because we're just going to say, watch it and re-refer if that number ever gets interesting, and providing those parameters. So those are probably the most common things that I see as a hematologist, is with mild anomalies on blood work that don't need anything except monitoring and reassurance.
Wonderful. Thank you both for sharing. So I will let you know that endocrinology and hematology are two of the top use specialties, not only in the eastern region, so southeast and central east of Ontario, but provincially as well. So it's great to know that there's a lot of different topics that you can manage via eConsult. So if you were talking to a primary care provider who would be sending their first eConsult to one of your specialties, what are some key elements that you really appreciate receiving from that requesting provider? So is there anything that when they're completing an eConsult for endocrinology or hematology that you would like a primary care provider to keep in mind that really helps make sure that you're able to answer their questions?
So I think kind of the lab-based specialties where we don't necessarily have to do physical exams are really well suited to eConsult. So if there's going to be a real need to examine an abdomen or feel a lymph node or a breast mass, I mean, those aren't going to be well suited. But something where it's a primarily lab-based hematology, endocrinology, works out really well. So sending us copies of all of the recent lab results really helps out a lot. We do have the capability of searching for those. Sometimes people send me information, it isn't quite enough, but I can access the file through Connecting Ontario. So sometimes, or I'll just put in a request saying send me more information. Yeah, more information you can send about your details about your patient. But on the other hand, they don't have to be super long. We're not gonna, it's not like you're a med student, you're gonna be grilled on your what you've written and all that. And we recognize that people are busy in practice. So they don't have to be 6-page long or anything like that. Often just a paragraph. Asking the specific question you want to know. So in the diabetes field, people are often telling me, is this drug going to be safe or not? And just a very specific question is fine. Yeah, okay.
Yeah, I would echo that exactly. I want a concise but kind of complete past medical history medications, especially for hematology, as there's a ton that interact with the results of the CBC, and then I want, the labs that caused you to ask the question and kind of the longitudinal history of those labs too, because sometimes I look back and it's like, yeah, well, he's had platelets of 130 for 12 years. So don't worry about it. Yeah, it's nice working in a lab-based specialty when it comes to eConsults, because the physical exam for the most part really doesn't come much into it.
That's great. Thank you. So my next question for you both is, how have you incorporated eConsult into your workflow and practice? So noting that there are a number of different things that are on providers' work dockets, how have you found incorporating eConsults and responding to them in terms of your daily workload, or is it more of a weekly routine? So if you could give us a little bit of insight, especially for those specialists on the call tonight who might be thinking of becoming an eConsult responder, what should they expect, or what are maybe some advice and tidbits you have for incorporating that into your workload? And I'll start with maybe Dr. Robin Holden on this one.
Yeah, I think we all do it differently, but what works well for me is finding a dedicated time every week to do it. My time, believe it or not, is Friday afternoon, and that's when I'll do it. And I'm not as stressed then, and it's fun to do it. So I'm not scanning it every day, and I know, but there are some providers who do it every day. They'll do 1 or 2 a day. But for me, it works better if I just set aside some dedicated time every week to do it. But that would be very individual. Mm-hmm. And you can control the number of cases you do. So it is, I must admit, the financial reimbursement is a nice thing. Knowing that you're helping out, you're doing a good thing is rewarding in itself. But you can limit it. If it ever starts to feel like it's too much, you can say, no, I'm only going to do 4 a week, 6 a week, 10 a week. You decide. And then you do sign out when you go on holidays, or you're going to be away. It's very easy within the system just to say, sign me out for the next week or 2 weeks or over the holiday weekend.
Yeah, and I'm much more free form about it. I will just do it whenever the mood strikes me, in terms of, when I'm not in clinic, if I'm finishing up paperwork anyways, and I have, all my clinical stuff open, I'll just do an eConsult or 2 here or there. The one thing I'd say in addition is I will turn off my eConsult availability when I'm on service, because that's becomes more inconvenient to get that done. So I'll just turn it off.
Perfect. And then question for you both. Have you guys engaged in that back and forth communication with providers that I was talking about a little bit earlier? So have you ever felt the need to ask additional follow-up questions, or have you had experience with that conversation on eConsult going back and forth a little bit longer than just your traditional question and answer?
I have sent back requests for more information and I've never actually got a reply.
Oh.
Which I think is maybe a mistake of the way I do things, because I'll provide some kind of anticipatory guidance and then say, by the way, it'd be helpful if I had XYZ, and then clearly whatever I've provided was adequate for that position and they don't reply. Rarely do the requesting physicians tag me back to get a little bit more clarification. I'd say the vast majority, it's really been they send the question, I send an answer, and then I get a little case completed notification a few days later.
I've had a lot of back and forth for sure. I've asked for more information and people send it. And then on the other hand, I've written something and I've said monitor every few months, and they'll send back, can you be a little bit more precise? Are we talking about every 2 months? Are we talking about every 3 months? And I'm happy to be more specific. And then what I really love is when you finish it and you send it off, if they have to close the case off, and sometimes people will scribble, that was really helpful, or that's just what I needed, or thank you so much. Often I'll send people papers that I've found. People will ask me very esoteric questions. I got one last week about somebody with hypocalcemia, and I spent hours, no, I'm exaggerating, but I spent some time on this case, and they'd written that the patient had just had dengue fever. And then I'm researching dengue fever and hypocalcemia, and there is a relationship, and I sent them the paper, and it was a lot of fun, and it was fun to get some feedback from them at the end. So yeah, if you have time when you close the case off, just saying that was helpful really gives us some lovely feedback.
That's awesome. So just being mindful of time, I do want to make sure that we have the opportunity to take some questions from the audience, or address any topics that they might like some additional information on. So I will turn it over to anybody who's joining us live here this evening. If you have a question that either myself or Jennifer and Robin can answer for you in regards to eConsult, feel free to come off of mute or to put it in the chat, and we'd be happy to discuss that.
Maybe while we're waiting, I'll say that I actually use eConsult myself, and the number one specialty I'm asking is dermatology. I love the fact that you're able to upload an image and get an opinion about something that somebody's showing you in the clinic. So I don't know if you use it yourself, Jennifer, ever to another specialty, but derm's the one that I use as an endocrinologist. People are showing me weird skin lesions all the time.
Yeah, so specialists sending eConsult is something that we're really starting to see emerge, not only in the Southeast region, but across the province as well. And it's definitely something we're looking to learn more about. So it's great to hear that you're able to use the service, not only as a responder, but as a sender, and that dermatology, which is the most used specialty across the province by far, is how you're using so. And I'm just seeing a question come in the chat here. So they're asking if we can comment on the use of pediatric allergy consults in the province. So what I can say from the program perspective is that there is the option to send to the provincial group. So there are specialists who are answering questions for allergies in general, and they're also working in conjunction with those who have a specialty in pediatrics for that. So it can be accessed through two different ways. You can either search it via the allergy route on eConsult and subspecialize in pediatrics, or you can search it via pediatrics and subspecialize in allergy. So there is that use. In terms of how frequently it's used, it really just depends on the needs of providers. If they're encountering a case that they maybe need additional eConsult advice on. But it is something that is available. We do have specialists available provincially who will answer regardless of your geographical region. So that is something that is available for people. And I'm seeing Shannon, your hand is up if you'd like to go ahead.
Thank you. And thank you so much. I really appreciate the panelists coming. Hearing from both of you has been really helpful. One hesitation that I hear from specialty providers is just about billing and funding. So, you know, the elephant in the room. How would you say, you know, you balance that? Obviously, you could probably get paid more to see all your e-consults in person. But how do you find it in terms of like, is it more efficient to do e-consults? Is it still, do you still feel fairly remunerated, or is there anything else that you see as like a better benefit than, you know, maybe the slightly lower remuneration you would receive for these types of patients?
I mean, I'd say for the amount of time. Sorry, go ahead, Dr. Holden.
No, you go ahead first. Yeah.
I was going to say for the amount of time it actually takes me to do these e-consults and for the number of patients with mild thrombocytic anemia that I want to see in clinic, that want to drive an hour from Belleville to be seen in Kingston for me to say, okay, you're fine, bye. The balance is good. We can use our clinical time for, you know, patients who maybe need a bit more counseling that I need to examine, that need kind of more specialist directed care. And I can spend 15 minutes to tell 3 people that your hemoglobin of 115 is normal and just do a yearly CBC. I mean, the balance to me, I don't worry about the remuneration of it personally. Given that Dr. Holden and I are in an academic institution anyways, and things are a bit standardized in that regard.
So I'm doing it, as I said, because I believe in it and I think it's the right thing to do. But if you said really black and white about that, you can add these on at a weird time. I mean, you can do 3 over lunchtime that you wouldn't have time to squeeze in, and if they were live patients. So it could actually be an add-on to your regular billings. You could do it now before you go home, do 2 or 3, and you don't have to worry about someone shepherding them into the room and engaging them in conversation. So yeah, I always think it's like an add-on to your regular billing. So
Thank you so much. And I've also heard the adage, you don't make money off your wait list, right? So that's the other thing to consider. It's nice to be able to give patients this care, you know, when they need it, and not, I mean, I know hematology a little bit, and I know that, you know, our wait list here is long, you know, beyond a year sometimes for benign conditions, right? So it's really nice to be able to give some direction for that, you know, in short order, and to improve patients' quality of life, and help support our primary care colleagues as well. So yeah, no, I appreciate all you're saying about those benefits. That's excellent.
All right, I'll just give it a moment to see if there's anybody else in the audience who has a question for us, or if anything's going to pop up into the chat. I guess while we wait, Danielle, do you have any questions for Jennifer or Robin while we have them here today, or anything you'd like to address while we have this the attention of everybody?
No, I think great conversation this afternoon about e-consult, and especially from, you know, 2 veterans of the system who have been responding to e-consults and setting e-consults for a long time now. I did mention in the chat that we do have an accredited webinar series. So if you want to hear from other specialists by going to our YouTube channel, you'll hear from psychiatry, pediatrics. Dr. Holden has a webinar there for endocrinology. I think we have gastroenterology as well. So I think there are 8 short videos in total. So if you're wondering about, you know, for specific specialties, what's an appropriate question for e-consult, or what doesn't work through e-consult, it's a quick way to spend some time and get some key information. So.
All right, and then just while we wait to see if anybody else has anything they'd like to address, I'll just ask one last question of you both, Jennifer and Robin. So outside of everything you've already mentioned, which has been fabulous for everybody here to listen to and hear, do you have any additional advice or recommendations on someone who might be beginning the process of embracing e-consult? So whether that be primary care or specialist, if they're just getting started in their e-consult journey, is there any pearls of wisdom that you would like to share with them as they move forward and try to determine if this is something they'd like to start to embrace and practice?
I'll start
to-
then. I would say just get started and try it out. I mean, if you don't like it, nobody's going to force you to keep doing it. And if you find the volume too much, I think that's the thing I learned was that there was a limit to how much time I had in a week to spend on this. As much as I enjoy it, I had to limit the number of cases I'll see in a week just to maintain my sanity. And I also had to remember that sign out during a holiday, or sick leave or whatever, a long holiday weekend. If you really don't want to respond to them, just sign out. So don't burn yourself out. Make sure that it stays fun for you. But I honestly think that for specialists taking part in this, you'll actually find it fun and enjoyable.
Jennifer, do you have anything to add?
No, I would totally agree. I think it is fun. It's a good way to kind of get a sense of what your primary care providers are kind of seeing out there in the community. I'd say when you get started, if you can have those canned responses of like, this is my approach to X, that's useful. Make liberal use of attachments. And just, provide some anticipatory guidance in terms of, when is an in-person referral required? What are the next steps if, future monitoring comes back abnormal? I think that's probably the most useful because I know some family doctors will have a little box in their EMR where they can just say, Heme said, do this. And then that's there for their reference forever. So that kind of anticipatory guidance is, I think, the most helpful thing you can do.
Perfect. Thank you for those insights. So it doesn't look like anything else has popped up in the chat, or I don't see any hands raised. So just going to take a moment to just provide everybody with some additional resources and contact information. So if you would like to learn a little bit more about everything we've discussed here this evening, or would like to take advantage of some of the resources that we've talked about, as Danielle mentioned, we have our webinar series for the different specialties. We also have conversations with some of our primary care providers if you're more interested in the sending aspect of eConsult, so you can understand a little bit more what goes into sending those eConsults. We're happy to provide that information. So all of that is available on the screen here. And we do have our social media channels where we're always posting updates to the eConsult program when new specialists and specialties join our roster. If there's anything that we feel providers would benefit from learning about, any program updates, all of that is available from us. And I would just like to take this moment to thank everybody for joining us this evening. We really appreciate you tuning in to learn a little bit more about eConsult. And thank you to Robin and Jennifer for sharing your insights and wisdom as you've been eConsult responders for some time. And I'll turn it back to you, Shannon.
Yeah, no, thank you so much. I really do appreciate everyone's time to be here. Thank you, Stephanie and Robin, Jennifer, Danielle. I appreciate this. And I know even beyond anybody who was able to attend today, we are going to share the recording out. So hoping to really grow this program across the Central East region of Ontario and, make that connection between specialty care and primary care in this digital world grow even more. So thank you so much for your time and the support to get this moving more in our region. I guess with that, we'll just close for the evening and thank everyone for attending. Again, Caitlin will send out certificates for those of you who are looking for credits to be here. And again, thanks everybody for coming tonight. Have a great evening.
Thank you. Bye.